This afternoon, 10 on Your Side brings you a special coronavirus digital discussion about the pandemic. Specifically, we're talking about vaccines today. Thank you for joining me for this special web conversation. We have them on most Monday afternoons right here at 1:15. And joining us today is Ed Brazle. He is the EMS chief for the city of Virginia Beach. He's a familiar face to many of our longtime 10 on Your Side viewers. Ed is working with the city of Virginia Beach Health Department's vaccine efforts to get these shots to the right people at the right time. Ed, welcome.
Hey, thanks for having me.
Now, let me start by asking, Virginia Beach opened up registration this morning for those in Group 1B to get the shot. Now, those are people over the age of 65, frontline workers, such as grocery store workers, mail carriers, jail staff, teachers. What has the response been so far?
We've seen a large response to this. So lots of people have gone into the website and have pre-registered through that, which is very exciting. So this is the first step to a wider audience getting vaccinated.
So today, is it just the registration for 1B, or are shots going into arms in Group 1B today as well?
There's actually shots going into arms. These are people who signed up either via their employers, via their employers last week or the week before, and we're given 9,000 vaccinations this week at three closed pods. But the pre-registration is starting to build our lists that we'll be drawing from as more vaccines arrive in the coming weeks.
So if you did not get a chance to sign up through your work, say as a teacher or a police officer, and you're able to sign up today, you can go online. We are getting questions from some of these viewers who are trying to sign up today and seem a little bit confused by this registration process on the web. They're telling us that it takes them to a map and then they don't really know what it wants. It's asking for location. You know, do they want my address, my work, my vaccination location? And they're saying it won't pick up a specific address. So is anyone working to simplify this process, or what's the problem?
We have a number of technicians that are constantly monitoring and tweaking the site. But what it's trying to do is just get you into the area of where you either work or live. The point is to validate that you're eligible to use the Virginia Beach portal, which again, you have to work or live in the city is what we're looking for. But right now there is only one vaccination site. So you're being operated down at the Finch Center. So your neighborhood or your specific address doesn't matter at this point.
All right, great. Let me ask you another question, a concern from some viewers, and that is those who are in Group 1A and they haven't been given a scheduled time to get their vaccination yet. And some are wondering why the city is moving ahead at all.
Well, it's actually the health department that decided to move on to 1B. If you're you believe you're a 1A person, your employer needs to contact the health department to get you in the system. So to be clear that just because we started the 1B and this portal, there are still other pathways to be scheduled. And so 1As or maybe even 1As that just changed their mind and decided they want to be vaccinated now, they can be inputted directly via the health department. So that's the one pathway. The portal is really the public pathway to catch up with the 65 and older or people with long-time chronic health issues.
Sure. Some people have been waiting a long time. So let me ask this. How long after I go online and request my appointment can I expect now to hear back and get a scheduled appointment?
Well, that's kind of the bad news of all of this is it could be weeks or months. You have to understand that there are over 8 million people in Virginia, and we're currently getting 105,000 vaccines a week. Those are then being allocated to local communities based on your population. So we've got, I've seen numbers, 90,000 or more people qualified for 1B in Virginia Beach. And at just a few thousand a week, it's going to be a while. But I'm encouraging everybody to be patient. Supplies, they're working on the supply chain all the time. And we want you to have your name pre-registered so that when supplies do come, we can grab you as quickly as possible.
So the issue is obviously a great demand, not a lot of supply. Is the issue, do you think, with the manufacturers, they can't keep up with demand? Or maybe are some places holding back their vaccine to give a second dose, which we know was not the original plan?
Well, I think, they can only make the vaccines so fast. And there's all sorts of theories out there of where vaccines are going, but it's just the whole world wants them. And there's only a couple manufacturers. Initially, there were some places, I'm not the Virginia Department of Health locally here, but there were places that were holding the second dose because they thought you give one, you've got to give another in 28 days. We've got new guidance on that, and they've been very clear that the second dose should be automatically shipped to you. So give everything you've got. We did not hold any here locally, but I understand there were other places in Virginia where people were potentially holding vaccines for the second round.
All right, so how much do you have right now? How many doses?
We are trying to give about 9,000 this week. Next week, we have not confirmed the number we're receiving, but it's looking to be somewhere around 5,000 that we should be receiving. We order every week, and then, which of course we'd put an unlimited order if we could, but then what our allotment is what we receive. And so we're anticipating a little over 5,000 next week.
Okay, and so part of the reason that you're able to have that goal of 9,000 this week, I understand, is that you received some vaccine from Sentara, correct? Tell me about that.
That's correct. Sentara received an allotment. There was actually a three-pronged approach that some goes to CVS and Walgreens, who is then taking care of your nursing homes. The local health departments get some, and then the hospital systems got a chunk. And Sentara was able to transfer 2,500 this week from their allotment to allow us to increase our number of pods. So it was a great partnership with them.
And is that just because they had employees that were eligible that passed on the vaccine?
Well, I'm not exactly sure whether it was their employees or their allotment was also to get into the community healthcare worker system. So we have a pod going, and it was really just easier for us to expedite their 2,500 into people's arms.
Okay. All right. Now, that being said, you don't know how many doses you're going to get week to week. So with that expectation, hopefully remaining at about 5,000 a week after this week, how long do you expect it to take you to get through Group 1B before moving on?
Well, if we only get 5,000 a week, we're going to be doing this for the rest of the year. We're optimistic that the numbers are going to increase, the supply will increase. So we have contingency plans. When we started this, we were only vaccinating 500 at a pod. Today, we're at 3,000 at a pod. So we have contingency plans to push that closer to 5,000 in a pod. And so if the vaccines come within a few days, we'll be able to bring in the staff to give more.
Okay. And let me ask about that. So how many people do you have giving the shots right now? What does your staff look like?
Well, and that's a great question, because this requires a tremendous effort from people directing traffic in the parking lot to registration to medical monitoring. Today, we've got 30 actual vaccinators. So you would go in and there's 30 tables spread out, and then you're directed to a table and they give you a shot, and they're shooting 6 to 8 people per hour. So at our full flow, we can deploy 40 to 50 vaccinators, but that's a huge commitment of personnel. So today, most of the staffing is coming from the Volunteer Medical Reserve Corps, from the health department, or city staff out of EMS and the fire department and police department. We will probably be expanding that to other Virginia Beach City employees, because all told, in a day, there will probably be 200 people working at that vaccination site at any given time.
And so right now, as you mentioned, you're doing all shots at the convention center, 3 separate pods, but eventually your plan is to move into the community more. Are you going to need more healthcare volunteers to help speed up the process now or in the future?
We'll always need more volunteers. There's many strategies that are being worked out, and really that's more the health department than the city, but in terms of getting these shots to the doctor's offices or to pharmacies, or to groups that have transportation or mobility issues. And all of that is going to take people, whether it's just somebody driving the medication from point A to point B, or somebody handling the registration process. So we're always going to need people. We're obviously, a priority right now is on people who can give shots, nurses, paramedics, that sort of thing. But there's a role for anyone who wants to volunteer with our Medical Reserve Corps. And so, for our volunteer rescue squads, of course, I have to put that pitch in.
Of course. So should they go ahead and just reach out to the Volunteer Medical Corps, reach out to EMS, or to the City Health Department, or all of the above?
Contact the City Health Department and tell them you want to join the Medical Reserve Corps. That's the name of the group.
Okay.
And they're doing a lot of the heavy lifting right now, metaphorically, for these shot clinics.
All right. Now, I understand that there was a very long line outside of the convention center late this morning for those who are getting their shots. How should people prepare? What can they do to help speed along this process once they arrive?
Today it's the first day this big, so we had a few things that some efficiencies to build in. But come at your appointed time. We had a number of people come early for their appointments, and that sort of clogged the system some. So that's the key. But be prepared to wait. It could take an hour to get you through, and so people who maybe have some mobility issues, feel free to bring a folding chair with you. I mean, we kind of like lines to vote. We do have wheelchairs available and chairs for people to sit in, but when you're talking about 3,000 people of all ages, you can't expect to be standing in line for a little while.
And of course, I'm assuming mask up and keep your social distance. Do you have marks on the ground laid out, or should people just try to be aware themselves?
No, we do. So masks are required. That's zero tolerance. You can't come in without a mask. And we're doing temperature checks as people come in. And then the floors are all marked off for that social distancing. In fact, in our waiting area, when you're done, after you get a shot, you have to wait 15 minutes to make sure you don't have a reaction, 30 minutes if you have some kind of medical history. And you'll see this giant room with 50 chairs all spread apart, at least 10 feet apart.
Okay. Ed, you've been with EMS quite a while, and we know that the state as well as EMS, you guys have been planning for pandemics and other emergencies for decades now. So with that in mind, how would you rate this vaccine rollout so far?
Well, in terms of locally, we're very pleased. We've been practicing drive-through shot clinics with the flu shots. We just did a drill in November where we vaccinated 80 people. So we've been working with the health department for a long time. I think there's just some challenges on communications. Then we can always do better with communications, and then the flow of the vaccine. So I feel good. 9,000 people being mass vaccinated in Virginia Beach this week is unlike very, very few communities are doing that much. So I feel good.
And so what do you say then to all those frustrated folks in Virginia Beach, the residents and the workers who just really want their shots and they don't see it in the near future?
I understand their frustration. I mean, I've got family, I've got friends who have not been vaccinated, and everybody, there's an anxiety level about this and wanting to get there. All I can say is be patient. We've got a lot of smart people on a local level working us out, and we're collaborating with our health department and the state to get these vaccines here as quickly as they're available. We are doing everything we can to expedite the process on our end.
At what point do you expect now that there will be enough shots, do you think, to go out into the general population to get a vaccine? And how's that going to work?
It's still going to be several months away, and that answer, they're still working on that. I think the answer is going to be getting it out into our traditional vaccination pathways, your doctor's office or a pharmacy. But they're just right now, there's not enough supply to do that. There's also some challenges with these vaccines. One has to be kept at a super cold level, or the other that still has to be frozen. But once you thaw it and puncture the vial, you have to give everything in the vial within 6 hours. So today, when we have a limited supply, you puncture that vial, you want to make sure you have 20 people in a line to give that vaccine. Otherwise, you're going to be wasting some. And it's like gold. We don't want to waste a single drop right now.
Absolutely. And so you are using the Pfizer?
We are using both the Pfizer and the Moderna. Today it's Moderna. Wednesday it'll be Pfizer.
And so
we've got experience with both.
So today is a little bit easier day for the workers.
Absolutely. And this is one of the challenges going forward is because this is a 2-shot regimen that you must come back relatively close to 28 days apart. You not only have to come back, you have to make sure you come back and get the right thing the second time. So that's all part of the tracking process that's done via the registration website, that you get Moderna or Pfizer or whatever's coming next.
Yeah, the logistics are just incredible in all of this. And Ed, it's a tough job that you have right now, I know. So we thank you so much for what you're doing there and the rest of the EMS crew. And thank you so much for taking time out to answer our questions today.
All right, well, thanks for having me. We appreciate the support, and we're going to get it out as fast as we can.
All right, thank you so much, Ed. I'll have a recap of our digital discussion for you coming up later today on WAVY News 10, starting at 4 o'clock. I'm Stephanie Harris. Have a great afternoon.